Okay, so this assignment is going to be for this video is going to be for the video professional disclosure statement. Um, I'm going to go ahead and read the purpose of the assignment. So, the purpose of the assignment is to support your development as an ethical and professional counselor in training. As a TSU counseling student intern, you are expected to clearly communicate your role, supervision status, confidentiality, informed consent, and ethical responsibilities to clients. The professional disclosure statement is a foundational tool that promotes transparency, client understanding, and ethical practice. This assignment aligns with the ACL Code of Ethics and the CACREP standards related to informed consent, supervision, and professional identity. It is grounded in course content from Chapter 1, Introduction to Clinical Supervision, Chapter 7, Organizing Supervision Experience, and Chapter 11, Ethical and Legal Foundations for Supervision Practice of the course. Textbook. Completion of this assignment demonstrates your readiness to communicate essential professional and ethical information clearly, confidently, and responsibly in the client facing format. So the required content will be identify myself as a student intern, explain the purpose and nature of counseling, explain supervision, confidentiality, limits of confidentiality, address client rights and responsibilities, discuss ethical practice, explain risk and benefits of counseling, address contact, communications, and emergency procedures, invited questions, and confirm client understanding. And then I'll go ahead and attach my written professional disclosure statement, which is attached to my reflection. Okay, so let's get started. Okay, so my name is Nautica Richard, and I'm a counseling student intern in the counseling program at TSU. So I just wanted to take some time today to explain my role, what counseling looks like, and important information you should know before beginning counseling services. This is called Professional Disclosure Statement, and it is meant to help you understand your rights and feel informed and comfortable. So first, I want to explain the purpose and nature of counseling. So counseling is a supportive process where you have the opportunity to talk openly about concerns, emotions, and life experiences in a safe and respectful space. Counseling can help you gain insight, build coping skills. It can also improve relationships, also teach you how to channel your emotions, work through challenges you may be facing. Counseling is not about being judged or told what to do. Instead, it is a teamwork process or a collaborative process, which means me and the client will be working together, and the client's involvement plays an important role in their progress. So, counseling isn't a quick fix. It isn't like I forget what they call it, but it isn't like a magic trick where you will be better just off of a few counseling sessions. They're just teaching you the skills on how to cope through life. Okay. To move forward, so I want to explain the purpose and nature of counseling. Uh, well, going back going back to explain the purpose of counseling. Like I said before, it helps you move through life, but it helps you learn how to cope through life. But it also teaches you how to cope with things that are beyond your control. So as far as like grief, death, losing friendships, losing a job, just really being able to help you to be mentally prepared and sound for those things in life, okay, and those challenges. Okay, so being that I'm a student intern, I work under supervision. So this means that I'm still in training while completing my graduate degree. My counseling work is supervised by a licensed clinical supervisor. Her name is Delisha Hullett, who has experience in the counseling field. She has a private practice, and she also works for an agency. So I help her with her private practice. So I sit in on group settings. I sit in on group meetings. I sit on virtual meetings. Sometimes I help her do paperwork, help her with taking notes, really just shadowing her, honestly. So my supervisor helps guide my clinical decisions, reviews my work, and supports my professional development. So sometimes she allows me to lead group while she sits in on the meetings, and kind of just talk me through maybe like reflective questions, those probing questions, and pushing the client to deepen their thinking. Um, Supervision is an important part of ethical counseling practice, and it helps ensure that services are safe and effective. During supervision, I may discuss your case for learning purposes. Excuse me. But I take steps to protect your privacy whenever possible. An important role of counseling is confidentiality. So, confidentiality means that what you share in counseling is kept private. So, I will not share information about you without your permission. Confidentiality helps create trust and allows you to speak openly during sessions. Now, confidentiality is important, but there are certain things that I have to speak on that will break confidentiality. Okay, so again, there are limits to confidentiality. So these limits are required by law and professional ethics. So information may be shared if there's a serious risk that you may harm yourself or someone else. It may also be shared if there is suspected abuse or neglect of a child, elderly person, or dependent adult. So yes, the things you tell me can be confidential, but if it's harming anyone or yourself, I'm really required by the law to share that information and not withhold it. In addition, information may be released if records are ordered by a court. So that means you confess into some type of heinous crime, and then you go on trial, and they learn that you're my client. I am legally required to release that to the courts. As mentioned earlier, information may also be discussed in supervision as part of my training. These limits exist to help keep you safe and others safe, and also myself safe. So that way, I won't be I won't be an accessory to anything or harming anyone or crime or anything of that nature. So as a client, you also have rights and responsibilities. So you have the right to be treated with respect, to ask questions, and to receive clear information about counseling. You also have the right to understand your role in counseling and to make informed choices about your care. At the same time, you have responsibilities such as attending sessions as scheduled, participating honestly, and communicating any concerns or questions you may have about the counseling process. Ethical practice is very important to me. I follow the American Counseling Association's Code of Ethics, which provides guidelines for professional behavior. These guidelines focus on protecting client welfare, respecting confidentiality, obtaining informed consent, and maintaining professional boundaries. Following ethical standards to help ensure that counseling services are responsible and client-centered. So those code of ethics for counselors, that's similar to like following like HIPAA or like lawyers. If they get in trouble, they can be disbarred. Even teachers, certain things you just have to follow just based on the professional responsibilities of your job. So there are both benefits and risks associated with counseling. Okay. Yeah, so there are both benefits and risks associated with counseling. Some benefits include increased self-awareness, emotional growth, improved coping skills, and better relationships. Counseling can help you feel supported and understood. At times, counseling may also bring up difficult thoughts or emotions. So that's where we talk about triggers. Sometimes conversations will get intense because sometimes you may have to relieve grief, you may have to relieve trauma, you may have to relive certain things. Relive certain things that trigger emotions that aren't good. This discomfort is a normal part of the process, and it often leads to growth. You are encouraged to share concerns about your experience at any time. I also want to explain contact, communication, and emergency procedures. I will share information about how to contact me, expected response times, and scheduling policies. Counseling services are not intended for emergency situations, so if you're having a mental health crisis where you're contemplating hurting someone or maybe suicide, you are extremely encouraged to call 911. Okay? Or even a crisis hotline right away. These resources are available to support you when immediate help is needed. I also want to emphasize that you are encouraged to ask questions. It's important that you understand the counseling process, your rights, and my role as a student intern. Please feel free to ask for clarification on share concerns at any point. Your understanding and comfort matter, and counseling works best when communication is open and clear. So, there any questions that the client may have there, or any concerns, they're encouraged to ask them. So, the most important part about the health client and counsel relationship is that there is trust and they feel comfortable opening up, not just on a personal level, but even just understanding how the entire process goes.